From the evidence, the answer is no. Towards sex or 286, doesn't increase a man's risk of prostate cancer. Once you're 40 years and above, then you want to get what is called the PSA test. Now, this is a simple blood test that the doctors would do, and it's just to measure the level of what is called the prostate-specific antigen, which is found in the prostate. And if this antigen is, or this protein is high in the blood, that is indicated. Now, that doesn't mean the person has got cancer. We don't recommend that men should wait to the symptoms, ideally before getting tested. So, I'm Raphael Bamidele. I'm a NIHR Advanced Fellow at the Hull York Medical School, University of Hull. My research, looks broadly at the psychosocial aspects of cancer inequalities, while predominantly also focus on prostate cancer in Black men. My background is public health, and my journey into prostate cancer research started when I came to the UK in 2012 to do my master's degree at the University of Bedfordshire. And one of the modules we did at the time was around health inequalities. And I remember fast forward to the time I had to do my dissertation. I had to select a topic, around that, which was of interest to me. So I was looking at the literature, and one of the things I found, shockingly, was around the inequalities that exist in terms of cancer experiences, risk, and outcomes. And one of the things I saw, because I was going to look at the breast cancer actually topic, and I saw that for Black women, the incidence of breast cancer was quite low. However, the outcomes were poorer, because by the time they present with symptoms, or by the time they are diagnosed, it's quite late. So that kind of, stirred my curiosity to try to understand, what were the barriers to early presentation, early diagnosis. So I did a research, a focus group with some women at the time, just to understand. So having gone through that experience, listening to women, Black African women in this case, at the time, kind of really stirred my interest to want to know more, and beyond that, to want to do more to address some of these inequalities, particularly from a behavioral, attitude, cultural beliefs point of view. So fast forward, I was going to do my PhD, and this advertised topic came up. I was going to look at prostate cancer and men. That also actually that's an interesting topic, again, because already I was interested in addressing inequalities. I was interested in the cultural influence, on health circuit and behaviors. So looking into the literature again, I saw that Black men were disproportionately affected by prostate cancer, while yet very little research had been done regarding this population. So for my PhD, I kind of focused on trying to understand psychosocial experiences and needs of Black men after prostate cancer treatment. So and ever since then, I've been building on this work. So that's kind of my journey really into this area. I mean, cancer generally is a global burden now. It's a global issue for so many reasons. You've got a aging population, lifestyle factors, so there's a lot of things that are happening that are making people to be more predisposed, to developing a cancer. We can't take out the family history, the genetics, all the biological factors, as well as the environmental and lifestyle factors, which all combine, to kind of influence people's risk of the disease. But when it comes to prostate cancer, it's the most common cancer in men now. And for Black men, they are twice likely, to be diagnosed with prostate cancer than white men. So that's 1 in 4 Black men versus 1 in 8 white men, and 1 in 13 Asian men. The evidence is not conclusive as to why these disparities do exist, but one thing is very clear: ethnicity, Black ethnicity, genetics, family history, and age as well play a lot of factors in influencing or driving that risk. for black men in particular, there's also that tendency to be diagnosed earlier at a younger age compared with other ethnic men. So I think it's one of those things, or one of those diseases that it's not just about prostate cancer, it's cancer generally. And it's great that there's a lot of research that is going on, to try to understand and in particular, develop innovative treatment. Because the thing with cancer is if it's caught early, then the outcomes are good, particularly for prostate cancer. If it's caught early, then go on to live healthy, good lives, long after. The only challenge is when it is caught late. That's when it can be a challenge. So that's why we all need to be really aware that this is something, that impacts, on lifestyle, that impacts on people, not just physically, but also psychosocially. And so it's a really big issue, cancer generally, and prostate cancer in particular for men. So what the evidence shows, published research, evidence from Cancer Research UK, for example, is that men with a family history of prostate cancer, also breast cancer or ovarian cancer. And what the evidence suggests is that because there's a particular gene called the BRCA gene, that it's also a driver, for these cancer types. So that's why men who are aware or who know that there's a family history of whether breast, ovarian, or prostate cancer in their family, they want to be proactive regarding their health. They want to be proactive to get tested quickly, particularly from the age of 45, for black men, or even 40. I mean, it's better to be proactive and know that everything is okay than leaving it till later. So I think that's also something to be mindful of, because sometimes I think it's just a family history of prostate cancer, but actually if there's a family history of breast cancer or ovarian cancer, then there's need for proactive health seeking and getting tested for prostate cancer. That's one of the myths that we really need to debunk, really. I mean, there's so many myths around prostate cancer, particularly within the black, community. And that's one of the myths that we need to debunk. And from the evidence, the answer is no. Too much sex or too little sex, doesn't increase a man's risk of prostate cancer. What the evidence shows is that family history of prostate, breast, or ovarian cancer, age, black ethnicity, those are the key factors that actually contribute to a man's risk of developing the illness. So we need to debunk that, that myth that sex, influences that. I think the thing is just a concern around the impact of the sexual life for most men. So again, that's one of the things that we need to, to debunk within our community. So currently in the UK, we do have a routine screening program that invites men, the same way women are invited for breast or cervical screening. However, what the recommendation says is that if you have a family history of breast or cervical or prostate cancer, then once you're, for a black man in particular, once you're 40 years and above, then you want to get what is called the PSA test. Now, this is a simple blood test that the doctors would do, and it's just to measure the level of what is called the prostate-specific antigen, which is found in the prostate. And if this antigen is, or this protein is high in the blood, that is indicated. Now, that doesn't mean the person has got cancer, because there's so many other things that can, raise the level of the PSA, whether the prostate, or at least it kind of sends a message around whether there's need for further investigation. So if you're a black man, 40 years and above, you're aware, of a family history of breast, prostate, or cervical or ovarian cancer, but from 40 years, you want to ask your doctor for a PSA test, as part of your routine NHS health check. And even if you're not sure whether there's a family history, once you hit the age of 45, men should be aware of their body and take care of their body. So you can request a test the same way you would do your blood pressure test, cholesterol, and all of that. You can just make sure that everything is okay with the prostate as well. we don't recommend that men should wait till they see symptoms, ideally before getting tested, or just being proactive to be sure that they are okay. However, if men experience, frequent urination, urgency with urination, having to get up very frequently, maybe at night, for example, you as a man, you know your body, you know what is normal for you. So don't try to excuse it that, oh, maybe it's because I'm taking too much water, or maybe, try to find excuses. If something is unusual, around that area, then you want to seek help. And in particular, sometimes, men do have blood, in their urine. That's what the evidence shows. But again, it's varies for different individuals. So the recommendation oftentimes is, once you're aware of your risk, just get tested. Don't wait until the symptoms, because sometimes by the time people start seeing symptoms, the cancer might be progressed, based on, research evidence. And I've been privileged to speak to quite a few, men who have experienced a diagnosis of prostate cancer. And in many instances, they didn't have symptoms. So many men I've spoken to who never had any symptom at all. Some have just heard, something, a community talk like this, or they've been told by their friends, and they've just gone, to ask their doctors for a PSA test, and lo and behold, it's elevated. But the good thing with such instances is that the cancer has been caught early, and such men are living healthy, normal lives even today. So men, don't wait for symptoms, but if you do experience symptoms, please speak to your GP immediately.
Do you find this video very interesting? Then give it a like, share it to others, then hit the subscribe button and make sure you turn on your notification. Oh, then let's go back to the video.
Yeah, I mean, in terms of research, like we are aware, inequalities do exist, particularly when it comes to the Black community. Massive underrepresentation in research. One of the things I'm excited about is that there's a move, even in terms of government, recognition, and support towards more research that is inclusive, that is targeted on this population. So for me, that's one of the things that excites me the most. For example, I have just been recently funded by the National Institute for Health Research to understand and, see how we can address stigma related to prostate cancer in Black men. This is one of the few, research studies that is focusing exclusively on Black men and recognizing, the risk, the poorer outcomes, and what needs to be done, to address that. So I think for me, it's really exciting, to be able to see research that specifically, addresses inequalities in that sense. Another exciting research, again, this research that is just being done is called the Transform trial. Which also is trying to look at, because currently we do have a routine screening program for prostate cancer. So what the trial is trying to do, and it's funded also by the National Institute for Health Research with Prostate Cancer UK. So what they're trying to do is just to get the best test, that would be appropriate for a routine screening program, and that will be effective, really, that would balance the benefit versus the harm that currently is the concern, around routine screening. So I'm really excited for how the research will go, and what the outcomes will be, and how in the near future, potentially, how that can transform early diagnosis, particularly for men at higher risk of prostate cancer. I think over the years, the awareness has improved. We can still do more, and thanks to what this fantastic work you're doing, to just create an avenue for men, and in particular Black men, to be aware, and also families as well. So I think the awareness is getting better compared to how it used to be, and I think that's been really facilitated as well by social media. You see a lot of, I mean, like this particular podcast now, there's a social media, avenue for people to hear about this, Instagram, TikTok. So I think that has really driven, improved awareness. But I think within the Black community, because we hardly talk about some of these, issues, health issues generally, and in particular prostate cancer or even cancer as a topic, I think maybe the awareness might still be, there's still a lot more to be done. And I'm looking forward to how people engage with conversations like this in order to drive, the awareness even a bit more. Yeah, that's quite interesting in terms of lifestyle factors, because again, that's also one thing to consider, particularly when it comes to prostate cancer. Like I said earlier, family history of breast, prostate, or ovarian cancer are risk factors, as well as ethnicity, age. Now, when it comes to lifestyle factors, yeah, it's good to keep yourself healthy. So, either way you look at it, for any cancer type, for any illness at all, the more healthy your body is, the better equipped it is to fight illnesses and diseases. So I think for men to keep themselves generally healthy, and for every one of us really, to live a healthy life is a good lifestyle. And it's a good preventative behavior. However, when it comes to prostate cancer, if the family history is there, for example, the black ethnicity, the age, and all those things are at play, regardless of the lifestyle factors, I think it's the risk remains. So that doesn't really change, the risk, which is part of why we really emphasize, getting the PSA test, speaking to your doctor if you experience symptoms. And I think that also really makes it important that we don't blame people. So sometimes many times we talk about stigma, and sometimes it arises from some of the mindset around the lifestyle factors that we think, oh, it's something somebody has done that's made them to be diagnosed with prostate cancer. Well, actually, it's not your fault. It's nothing anybody has done. It's just what it is. The biological factor as well, the genetics, we can't really do much, about that. However, if your body is in good shape, your blood pressure is good, you take regular exercises, you eat well, then if you're diagnosed, then your chances of, being able to, undergo, treatment and the body responding, accordingly, I think will be massively improved. But in terms of preventing it, just live a healthy life and reduce your risk of comorbidities, having other illnesses even apart from the prostate cancer. There's nothing you can do to protect yourself. That's the simple, based on research. So, because I'm speaking here from the point of research, but what we can do is we can prevent the poorer outcomes, through early diagnosis. Like I said, the genetics is there. So when we get to research, that is able to then, address the genetic factors, the family history, and then the ethnicity and the age, and those factors can take them out of the equation, then perhaps we might say yes, we can prevent it altogether. So from a point of view, or from research point of view, it's not one of those cancers, that are preventable in the sense of, doing something to totally avoid it. But the way we look at prevention is early diagnosis, because early diagnosis means what you have a wider range of treatment options. It means that then you don't experience the worst possible outcome from it. It means that the survival rates that are better, that you don't need to die unnecessarily from a disease, that is treatable. So I think that the key thing is that it is treatable. Prostate cancer is one of the most treatable forms of diseases. I've interviewed a participant before that at the initial stage when he was diagnosed, he was so anxious and fearful. But he said when he spoke to a friend, and the person said, if I was have cancer, I would rather have prostate cancer. That kind of really reassured him, because it's treatable. And that's the truth. It is treatable. There are lots of treatment options within the NHS. Globally, there's a lot of, even nationally, a lot of advancement in treatments and all of that. So again, once it is caught early, it is very, very treatable, and when live 20, 30, 40 years. In fact, the life expectancy is almost as good as somebody who didn't have it. However, that changes very quickly if it is diagnosed later. So people diagnosed at stage 1, for example, based on what the evidence says, stage 1 prostate cancer, they have up to 95% chances, living, as normal as long as anybody without it. By the time it gets to stage 4, that's already halved to 50%. So think about, that difference. The message for men is there's nothing to be afraid of. There's nothing to be afraid of in terms of screening. Because if you think about health as, What makes your body or your being healthy is what gives you the liberty to be here. If you're healthy because you haven't been proactive about your health and or necessarily, die from illnesses, then you won't be around to do all those lovely things that you want to do. The family needs men. Men play a crucial role in the family, the society. So I think anything that you have to do to stay healthy, there's nothing to be afraid of. We're from Africa many times. We have to do malaria tests, typhoid tests, all manner of tests. And we go ahead and we do all those tests because for people who refuse to, maybe they're experiencing symptoms, they don't go to the hospital, they die unnecessarily. But you discover that when people, maybe you're experiencing some symptoms, for example, and then you go to the doctor and they do whatever test they have to do, no matter how scary it sounds, you go ahead, you do it. They diagnose you, and before you know it, you get treated and you're your pathway to recovery. So many of us are alive here today because we took those steps. So there's nothing to be afraid of with the screening. A simple blood test will not hurt you. It's a blood test you get at the GP, the same way you will get a blood test for blood sugar or cholesterol and some of those other things they check. So don't be afraid, I would say, about screening, because the screening, just one test, could save your life and that of your family. Hi everyone, it's such a joy, to be here on The Expressions with Raphael. And it's just been a pleasure just to talk about prostate cancer awareness within Black communities and how, we can, talk a bit more about this topic and also take proactive steps, to ensure that Black men are not dying unnecessarily from this illness, which is very treatable. So please do like, do subscribe, do share, this podcast. And let's spread the word so that more men within the community hear about this important topic, and we can support them, and they can also be proactive in terms of seeking the necessary test, to get diagnosed early if they are at risk of prostate cancer. Thank you.